Dr. Jonathan. Okay, Dr. Jonathan Izudi. He is the recipient of the NIH Emerging Global Leader K43 Award, under which he focuses on integrating TB treatment into community pharmacies for people with TB and HIV in Kampala, Uganda. And in 2022, he received the UCGHI GloCal Fellowship. So he's our alumnus, which helped pave the way for his K43 grant. Jonathan has completed several NIH-funded postdoctoral fellowships in HIV and co-infections, impact evaluation in TB. His research centers on TB and HIV treatment outcomes. He has authored over 86 peer-reviewed publications, including 42 as the first author. Jonathan holds an MPH and MSc in global health and PhD in public health with a specialization in epidemiology. So it's a tremendous honor to welcome Jonathan. And so we have 57 minutes. So I hope that we have some time to ask Jonathan questions. And as he's talking, you can also, type in your questions in the chat function. So welcome, and I look forward to your talk.
Yeah, thank you so much for the honor and for this opportunity to give a talk to the GloCal fellows. So yeah, to get that started, my talk basically will provide some key insights and lessons in the area of how fellows can transition from being a GloCal Health Fellow to winning an NIH grant. But this will not be only restricted to K43 award, but just like any other award. So in that vein, I decided to title my talk as From GloCal Health Fellowship to a K43 award. Thank you so much. So yeah, to really get started, my talk has largely two areas of interest. One is basically to share experiences from the GloCal Health Fellowship Program with the fellows here so that they can use these experiences as a learning point for them and how these experiences could perhaps, help to move them forward. And the second goal is basically to demonstrate how the GloCal Fellowship Program, shaped my transition and to, obtaining the K43 grant, but also how it could shape the transition to research independence in general. So first is the GloCal Fellowship Program. Basically, once you get started with it, at the beginning of this fellowship, you make a promise. And the promise you make basically revolves around the research project that you want to undertake, but also you are entitled to providing some, career development goals. And these largely are short, clear, and focused. And so at the beginning of my fellowship, I had to do this. And I think everyone did this. And I'll, dive back to this later on. So for my GloCal fellowship, I decided to, am I audible? Do you hear me?
Yeah, we can hear you, Jonathan. Go ahead.
Oh, okay, excellent. Yeah, so let me try to move this away. Okay, good. So for my GloCal fellowship, I decided to, pitch my area of interest around three goals. So the first goal for my GloCal fellowship, and this I picked directly from my application, one is to advance my key skills in impact evaluation methodologies so that, I'm equipped to design studies that are more rigorous around the area of impact evaluation of health policies and programs, but that also have benefit at the national and global levels. And so I felt that the GloCal fellowship will offer me that advantage. And the second goal for my fellowship was basically to acquire good skills, in designing and conducting implementation sciences, but also qualitative research in the area of TB and HIV, given that my area of interest largely in the space of TB and HIV. And the third goal was basically to generate pilot data that I felt and I knew will enable me to apply for larger grants, and that will catalyze my transition to becoming an independent researcher. Now, other than the three goals, I knew that joining the fellowship has a long-term goal. In that, first, it will foster a long-lasting research collaboration with the faculty at the UCSF, but also the entire UC system. And so I felt the GloCal fellowship, gives me that advantage. And I was very confident that doing the fellowship will enable me to become a leader, but also an independent researcher in the space of evaluation. So right from the beginning of my fellowship, I had an intention. And this intention was deliberate. And I thought that everyone has this kind of intention, which is really deliberate. And I'll dive into this, why I had to highlight this. So my project for GloCal Fellowship focused in the area of intensive adherence counseling, which is largely a psychosocial intervention offered to individuals that have failed to suppress their viral load after 6 or more months of ART. And I thought that one, I could evaluate that intervention to show the impact so that I'm able to inform a clinical practice, but also the existing policy. But I did also know that some people, even after receiving this intervention, do not suppress. So I wanted to understand why this happens. So my second objective was basically to look at what the risk factors are for the viral load to persist, above the suppression threshold. And lastly was basically to understand what the barriers and facilitators are from a qualitative angle. So I deliberately developed 3 objectives for my GloCal fellowship. And I also was able to channel out 3 papers from the GloCal fellowship. And of course, the fellowship allowed me to work with a number of people that shaped my fellowship, my K43 award that I will talk to later on. So now we are in this fellowship, the GloCal fellowship. How can you use the GloCal fellowship? How can you use the opportunity, the time offered to you to shape your trajectory to other awards, not only the K43? So the K43 grant, to give an insight to some people here, is basically a career development award, and it's offered by the National Institutes of Health under the Fogat International Center. And it's an award that supports early stage investigators from low and middle income countries, ultimately to help them to develop and become independent researchers. Sometimes it's known as Emerging Global Leader Award. So most importantly, this award helps you by giving you protected time, and you're able to benefit from deliberate, targeted, or focused mentorship in global health so that you can become an independent researcher. And therefore, it aligns very, very well with the GloCal Health Fellowship that you guys are pursuing. So there are a number of key considerations for the K43 award. There is an eligibility criteria. Of course, it is targeting citizens or residents of low middle income country, and it offers you protected time, at least 75%, which you will devote to research, but also training. And your research areas should be of global health relevance. So it must address issues that are affecting low and middle income countries. And then it must demonstrate sustainability. So you should work with a research project that will lead to a long-term independent research. Lastly is around the area of mentorship, where you'll benefit from strong commentary and career development support as critical components of these interventions. Of the K43 award. So the areas I've marked with a double plus are areas that fit very, very, very well with the GloCal Health Fellowship. And actually that I benefited so much from my fellowship. I used my GloCal Fellowship opportunity to first conduct research that I felt addresses a global health problem, and that I used at my advantage while applying for the K43 award. But also, I worked with a number of mentors during my GloCal Health Fellowship that in turn supported my successful application for a K43 award. But also, through the GloCal Health Fellowship, I am now able to establish a long-term collaboration with the mentors who supported me during the GloCal Fellowship. And now we have extended this collaboration to the K43, and we are looking forward to extending this collaboration to other awards. In essence, the GloCal Health Fellowship offers you a huge opportunity as a fellow to move from where you are to becoming an independent researcher. So then, what was my K43 focus on? So I focused on integrating tuberculosis treatment into community pharmacies, ultimately to improve TB/HIV outcomes in Uganda. And because I had grounding in global health, I used the opportunity offered by the GloCal Health Fellowship. I was able to write a compelling grant application, and I received an impact score of 13, which I think anybody who has benefited from the GloCal Fellowship will be able to do if you use your time well. Now, the GloCal Health Fellowship offers you an opportunity to travel to the United States of America, precisely UCSF, for example, and you stay there for about 4 months. I decided to use my stay at UCSF focused on writing my K43 grant proposal, because the K43 grant proposal writing requires a lot of time. So through the GloCal Health Fellowship, I was able to have protected time of 6 weeks. I deliberately, planned for 6 weeks within my GloCal Health Fellowship to be at UCSF, working with my mentors and writing a grant proposal, building on the successes that we made based on the GloCal Health Fellowship. And so I want to thank the GloCal Health Fellowship for that opportunity that allowed me to have this protected time to write a K43 grant that went successfully. Now, the GloCal Health Fellowship also gives you a huge opportunity in terms of, writing a very compelling profile as a candidate to be considered for a K43 award. And so in the process of doing this, I was able, to profile myself along the GloCal Health Fellowship. So I was able to point in the candidate section that I completed the GloCal Health Fellowship program, and therefore I am grounded in the area of global health, and therefore I am a good candidate to be considered. And even my GloCal Health Fellowship was able to give out 3 research outputs that I highlighted. And the reviewers were able to capture this. And this was so key in my grading. And so I thought that I should highlight this to all of you, that the GloCal Health Fellowship is a huge opportunity. It's an immense opportunity for everyone to move from where you are to where you want to be. Now, the GloCal Health Fellowship also gives you a huge opportunity. I want to move this down to, develop your research competence. I call it developing a triple threat factor. Now, for you to be successful in your research career, you need to have mastery of a number of skills. Now, first thing you need to do is you need to be grounded in a particular area of interest. So you need to be a subject matter expert. So for my case, I decided to ground myself in the area of TB and HIV implementation science. And so I decided to do my GloCal Health Fellowship around that space. But also the GloCal Health Fellowship gave me an opportunity to develop myself in the area of research methodology, but also analytics. So I was able to undertake a number of courses that allowed me to improve my methodology, but also analytic capability, because the GloCal Health Fellowship gives you some money that you can use to do some short courses. But also, there should be a deliberate or an intention that you need through your fellowship. For example, I decided to ensure that my fellowship gives out up, research outputs, 3 research outputs. And so during my application for a grant, I was able to highlight a collaboration that I established with my mentors through the GloCal Health Fellowship. And this was a huge issue when considering my application. So use the GloCal Health Fellowship opportunity to develop a triple threat factor. Become grounded methodologically, become grounded in a particular area of interest, and then improve your scientific writing, but also scientific output, so that you emerge as a strong candidate to be considered. Now, one of the important courses that I would like to highlight that I think every fellow should consider, and I am glad that at our time this was made compulsory, is the DCR, the Designing of Clinical Research course. I was able to do this course through the Uganda program, and our lead facilitator was Helen Biakwaga. So I was able to do this course, and I felt that this is a very, very important course for anyone who wants to have a mastery of NIH, grant writing skills need to undertake. It will help you to know how to organize your grant proposal, to write with clarity, to write with economy, but also to write with precision. I think everyone needs to take this course in order to acquire some of these skills in grant writing. And of course, through the GloCal Health Fellowship, I got introduced to a number of mentors. So you get introduced to mentors with whom you share, same discipline. So I was able to work with Professor Aditya Katamachi, who is my primary US-based mentor. I was able to work through Christine Sekaja, my primary local mentor here in Uganda, but not directly through the GloCal Health Fellowship. But because I had a GloCal a GloCal mentor, that is a Professor Aditya, he was able to connect me to a right mentor in Uganda when I wanted to apply for the K43 grant. Also, my GloCal mentor, Aditya Katamachi, connected me to other mentors like Noah Chiwanuka through the GloCal Health Fellowship, because then we are able to establish a research collaboration. And also use the GloCal Health Fellowship to extend my network with other mentors such as Rachel King, based at UCSF, but also Nora West, who is also based at UCSF. So in a nutshell, the GloCal Health Fellowship gives you that opportunity to get the right mentors, connectors, motivators, and so on. And all this can help to shape your career trajectory. And of course, the GloCal Health Fellowship, is a training. They're training you in global health. So besides my numerous, training before the fellowship, I was able to highlight, the fellowship as one of the key trainings in my academic trajectory. As I was writing the grant. So I decided to build my K43 grant application in the area of public health and global health and epidemiology, as well as my experience in TB and HIV. And this was a huge mark for me that I felt I should highlight to all of you. Now, the GloCal Health Fellowship um, also, permitted me to have a number of publications. And these publications, I was able to highlight in them as part of my scientific profile or publication profile. So as you do this, as you undertake the GloCal Health Fellowship, it's very important that you take deliberate steps to have some output from this fellowship in form of publication that then you can highlight in your subsequent grant applications. And lastly, of course, is the clear goals that I highlighted at the beginning of my talk counts. So I had 1 to 3 short-term goals that I was able to achieve through the fellowship, but then a long-term goal that I was able to highlight in my application. So I was able to state that I am building on already, the opportunity offered by the GloCal Health Fellowship that I think all of you should be able to take advantage of. So this is my talk, the end of my talk. I kept it short in order to give more time for us to interact. Thank you very much.
Jonathan, that was really very, very informative and very useful for our fellows. And I'm really impressed that you were able to share your work in about 20 minutes. So I think this is great. We have a lot of time to ask questions. So trainees, fellows, scholars, if you have questions, you can either use the chat function or you can unmute or raise your hand, just chime away. So while you're thinking about questions, I guess one immediate question I have is, Jonathan, in terms of the last point you made about publications, I was really impressed with the number of publications that you were able to complete, as well as first author publications. So what is your secret sauce? Because I think at this stage in your career, I think having like close to 90 publications is really impressive. And it's also publications that are tied to your work, the triple threat that you were talking about. So what's your secret?
Yeah. Interesting question, and thank you for that question. And many people ask me same question, and yeah. So I think I have always aimed, to be able to do a number of things on my own. It's very hard to be a complete researcher, but I think you can deliberately set yourself out there to acquire a number of skills, a number of competencies that can allow you work more rapidly and more faster. And of course, this I call it the triple threat factor. So personally, I work a lot independently. For example, I can do the analytics, I can do the methodology, I can do all sorts of things. And if you can do this, you'll find that you can do a lot of work within a short space. For example, I can tell you this is February. We have not yet ended February, but I've written 4 complete manuscripts that are submitted already and they're under review. And this is because I have the triple threat factor that I think every researcher needs to develop. You do not need to rely largely on a biostatistician. There are simple things you can do, sample size estimations, analysis, and so on, unless really it's a complex analysis that you need the help of somebody. And I think as fellows, if we are to make a huge impact, we need to develop some of these skills. And then the second thing is that, we usually have lots of ideas, that circulate, every day in our minds. And every time an idea comes up, I think it's important you take some steps to write it down, and eventually you'll keep developing this idea, and then it becomes a very strong research idea. For example, I can tell you, My K43 grant idea came while I was traveling up country from village to Kampala. And immediately the idea popped up. I picked a paper. I picked actually my phone and I started, writing down the entire idea. By the time I reached Kampala, I actually had a draft
Mm.
and I was able to now expand on that. So use your time well and develop yourself, have some key skills, some key competence. It will help to move you much, much faster.
Yeah, well,
Over.
thank you, Jonathan. That's great, and I couldn't agree more. And I think, as you know, many of you, as you're starting your career at the moment, one of the things that will really make you a strong candidate going forward is, because we're in the research academic, environment, like publications is really key. So I think to Jonathan's point, you know, kind of establish like a pattern or routine where you can provide meaningful time for you to invest in writing. So sometimes it's really hard because you have so many things that you have to navigate, including like providing clinical care for some of you and other administrative responsibilities. But if you can carve out like some protected time, and it could be like a routine where every Wednesday from, 7 to 9 o'clock, I'm just gonna not answer any emails, but just focus on writing and then just build up that habit. And then once you have like your publications, it's something that you take, that's yours. And it kind of helps you in terms of navigating the next phase of your career. So yeah, publications is key. And then also, as Jonathan mentioned, thinking about how your publications are kind of aligned and connected together and going forward to build your career. So yeah, really impressive, Jonathan. Congratulations. Can't believe you have 4 manuscripts you submitted. I haven't submitted even one this month. Um, all right. Any questions for Dr. Izudi? You can type in a chat or just unmute and ask. This is your opportunity to learn from him.
Hello, Dr. Izudi. Thank you so much. And again, you've been so productive and accomplished so much in such a short period of time. It's amazing. Could you walk me through your timeline for the K Award, when you started writing, when you wanted to have your deliverables, with a particular emphasis on like how much preliminary data did you have for that, and how much, yeah, talk about a little bit about like the preliminary data that you were set up that kind of proved that your thing would be successful or not, and particularly your timeline.
Yeah. Thank you so much for that very, very valuable question. Yeah, so in terms of first preliminary data. So preliminary data is very, very, very key, especially when you're applying for a grant of this nature, simply because you will need it for a number of things. One is it could be, you could use it to build your hypothesis and therefore your grant and a number of research questions you want to address. But also it could demonstrate that, you are expanding the kind of research questions that were not answered in your initial research projects. So having preliminary data gives you a lot of advantage, especially when you're applying for a K43 grant. And that's why I encouraged all of you to be deliberate with your GloCal Health Fellowship so that you're able to carry research projects that you want to carry on. So it should not just end at this stage. This will be something that you should build on after completing the GloCal Health Fellowship. Now, in terms of timelines, so first is the K43 grant application process is very, very, very intensive. It requires a lot of writing really. And you'll need a lot of time to do this. Some people will tell you you need about 6 months, of writing. And some people will tell you need about, 3 to 5. I've never had somebody, say you need less than 3 months of writing. So you need a lot of time, a lot of protected time. And that's why I was able to highlight, the 6 weeks I spent at UCSF basically was, focused on writing, meeting mentors and writing. So you can imagine the amount of work I did. So in my case, I think I spend a lot of time thinking than in writing. So I spend a lot of time to conceptualize the idea mentally, to think through it, to think through the methodology, to think through, is it really something I need to do, innovativeness and so on. And once I conceptualize that this idea works, and I think it's something that will be appreciated, and then I wrote my first, they call it aims page, sort of like a summary of what you want to do. And I shared it with my mentors. Of course, my first idea, was okay, but it lacked some aspects of novelty, but also significance. And so even when my mentor gave me, a go ahead, we sort of like changed our mind like after a week and said, no, I think let's not, focus on this. Can you think of something else? So I spent a lot of time again to think through, and then I came with an idea and I wrote, a one pager, and I said, and like, yeah, I think this can work. And then I started working. So that will be around towards the end of August is when my, this idea came up. And so by the time I came to UCSF, I was already ready to write, and so everything is tightly aligned. So you need time overall. Thanks.
That's great. Okay. Any other questions? Later in the chat. So Jonathan, in terms of your K-43 applications, were you funded the first time around?
My connectivity dropped. I'm sorry if there is a question directed to me, please repeat.
No worries. So I was asking for your K-43 application. Were you funded the first time around, or did you have to resubmit?
Yeah, this is my first application, and
Okay,
perhaps I got lucky. I got funded.
that's great. Yeah, that's really awesome. So, in the past, what we talked about was like, persistence. So oftentimes when you submit like K-43 Career Emerging Global Scholar Award, you get reviewed and then you get a score, but it's not really funded. So you have to like persevere and, submit it the year after. But I think in your case, it's been, you were, because you were such a qualified candidate, you were funded the first time around. So something to aspire to. So if some of you are thinking about K-43, I think Jonathan's advice is really valuable. I do have to say that currently our, political climate may not be as promising in terms of commitment to global research, but for the K-43 mechanism, I can tell you that it is still going on. There's going to be a new batch of applicants that will be reviewed next month. So I think it's a promising thing. So, any questions? Any other questions? Okay. So, yeah, so Jonathan, I want to say thank you again for sharing your work and your providing valuable, insight in terms of events in your career. And This is recorded, so I'm sure our trainees will be able to kind of review your slide deck again. And if it's okay, I hope they can like get in touch with you if they have any additional questions. Okay.
Yeah, so I'm happy to provide more guidance, but also to help any fellows who will be interested in understanding the K43 application process
Mhm.
and so forth. So I'm available, and thank you so much.
Oh, great. Thank you. And Julie, do we have any housekeeping updates?
Not really.
Okay.
Keep going.
Yeah, keep
Keep on
going.
keeping
And I'm
on.
sure there's works in progress and,
Yeah.
career development seminar coming up. So
Every
uh,
month, a whip, and every month.
I want to say, stay well, stay safe, keep doing what you're doing and take care of each other. And good to see you all. And thank you again, Jonathan.
Thank you so much.
Thank
Bye.
you, Jay.
Yeah, thank you. Bye.
Right. Bye, everyone.
Bye bye. Rolly, bye bye. Nice seeing you.
Bye.